Hi, it's a privilege to welcome you on to the Rajiv Gandhi University of Health Sciences Jeeva Raksha COVID Crash Course. My name is Dr. Ramkrishnan Nair. I'm an emergency medicine consultant as well as the Chief Executive Officer of Jeeva Raksha Trust. Jeeva Raksha Trust is an initiative of Swami Vivekananda Youth Movement and Rajiv Gandhi University of Health Sciences, and it has been formed to promote emergency care and skills education amongst both healthcare as well as non-healthcare individuals, aiming for a better evidence-based, state-of-the-art emergency care provision for all citizens of the country. We also focus on emergency care education and research, as well as supporting in disasters, pandemics by building resilience and capacity building, as well as responding in relief activities. The COVID Crash Course covers multiple elements, and the CRASH stands for Critical Care, Rehabilitation and Reassurance, assessing and adapting according to the challenges that a pandemic of this proportion throws at us. Yes, for safety in transport, as well as the precautions we need to take, be it personal or for the other patients, relatives, etc. And H stands for the most important thing, to have a heart to care for your colleagues who are going under so much stress, the relatives who are having to cope with no information, no sight even of their critically unwell patients for large periods of time, as well as the importance of CPR in a changed format when there is so much of aerosols and droplet infection all around us. The topics we're going to cover is infection control, assessment of a COVID patient and how to pick out a critically unwell patient early, oxygen therapy, different modes of delivery, how much to give, what to give and when, medical management of COVID, which includes pediatric management as well as mucormycosis, COVID and comorbidities and how to deal with comorbidities in the light of COVID. As we mentioned, cardiac resuscitation and what to do and what not to do compared to what we are aware of as previously existing guidelines. Palliation, an often ignored concept in advanced COVID, where there is an advanced will or a directive from the patient or the family, whether we could afford them the dignity and a kinder way of passing out, respiratory rehabilitation, and how to support the COVID warriors, including yourself if you're in the front line doing shifts day in and day out. So to come to an overview, as we all know, 81% of patients are either symptomatic or asymptomatic. So those are the ones who don't require any institutional care. They will require a little bit of telephonic counseling, triaging, and just observation to make sure that things are going in the right direction. And then the other 19% are the ones which require established input, of which 14% are severe and 5% are critical, of which sadly there is currently a 3% of death according to the WHO data. So the asymptomatic or mild illness can be managed at home or a COVID care center where it is mostly emotional and physical support, medication, a little bit of respiratory therapy and reassurance, and medications are primarily symptomatic medication. Patients need to be monitored closely, and the whole idea is if you're in the 81% of asymptomatic or mildly symptomatic, just keeping an eye on to make sure that the patients don't get into the other categories and require further medical care. And we will be covering the role of first line care providers, which is very crucial in this phase of the illness. So the moderate illness needs oxygenated bed, and nowadays we're calling it the dedicated COVID health center. And they might also require steroids. And here you will have input from medical and nursing staff to identify severe illness and refer them promptly along to the next set, that is a dedicated COVID hospital with an intensive care unit. So that is where the severe illness are treated. The triage flow of a COVID patient. So they come initially as an asymptomatic or mild symptoms, in which case they'll be treated at a COVID care center or home. If they're coming to us as a moderate symptom, we will be looking at the symptomatology and putting them in a dedicated COVID health center where there is oxygen doctors and nurses. And according to their pathophysiology and parameters, if they become severe, which is tachycardic, hypoxemic, a respiratory rate of more than 24, or showing signs of systemic involvement like hypertension or acute kidney injury, they can be referred to a dedicated COVID hospital, which will have support in the form of non-invasive ventilation or ventilator support and specialists to cater to the different complications. Or if the condition is untenable and the patient doesn't want to go through all that, as it is futile, they could go into a palliative care setup where their symptoms will be managed and they'll be kept in comfort, in dignity, till the time that they pass away. I hope you are comfortable and happy with the tone, the modulation, and the timing of our video slides. Kindly give us feedback at team@jeevaraksha.org if you would like improvements to the educational material that we are putting out for free consumption in our YouTube channel. With this, we've completed the overview of the Rajiv Gandhi University of Health Sciences Jeeva Raksha COVID Crash Course. You have the other modules coming after this, and I'll be rejoining you with the medical management of COVID. Once you've completed all modules, you could attempt an exam in our learning management site, the details of which will be provided at the end of the last module. And if successful with 70% of mark, you will be awarded an online certificate from Rajiv Gandhi University of Health Sciences, which will be valid for 1 year. Thank you, good luck, and best wishes.